Hello, seniors. If I told you that with just 1 cup of yogurt a day, already sitting in your refrigerator, you could have less bloating, more regular bowel movements, stronger bones and joints, a healthier immune system, a lighter spirit, and fresher skin, would you believe it? What is worth thinking about is that after age 60, many people have to live with constipation, abdominal bloating, and poor appetite. Older women are more prone to osteoporosis and fractures, and a weakened immune system means colds and infections visit more often. Many turn to expensive supplements, while a cheap, easier-to-buy, tasty, and sustainable option is forgotten: yogurt. This is a fermented milk product containing beneficial bacteria that balance the gut. Even a small serving carries probiotics, calcium, vitamin D, easily absorbed protein, plus potassium and magnesium that support heart rhythm and blood pressure. Unlike fresh milk, yogurt also has active components created in the fermentation process, useful for heart and immune health, things seniors especially need. I am an internal medicine doctor with decades of work in aging and nutrition in the US. Among the thousands of cases I have seen, many patients simply added the habit of eating yogurt every day and clearly noticed the difference. A calmer stomach, easier sleep, joints less creaky, a more relaxed spirit. In this video on the Health Journey channel, I am not selling any product. I will speak briefly and clearly based on reliable research and real cases. You will learn the 5 most important benefits of daily yogurt, how to choose the best type for your needs, and the common mistakes that make many people unknowingly lose the effect of yogurt. If this topic touches on what you are concerned about, please subscribe to the Health Journey channel, turn on the notification bell, and leave a comment. I am ready to try yogurt for 4 weeks. Thank you for your time. Your companionship is the motivation for us to continue bringing practical, safe content for seniors. The most reasonable starting point when talking about yogurt is the gut, the place that determines whether our digestion is smooth and whether our immunity is strong. In people over 60, the microbiome is often poor due to eating little fiber, using many medications, antibiotics, painkillers, stomach drugs, and the habit of drinking little water. The result is bloating, abdominal distension, recurrent constipation, and poor appetite. Yogurt is a fermented product that contains beneficial bacteria such as lactobacillus and bifidobacterium. When used regularly, they help restore balance in the gut through 2 simple mechanisms: increasing beneficial bacteria and reducing harmful gas-producing bacteria. When harmful bacteria are suppressed, the amount of gas produced after meals decreases, the feeling of heaviness and belching also eases. At the same time, the metabolites produced by beneficial bacteria help stimulate smoother bowel movements, thereby improving constipation. Another practical advantage: thanks to the fermentation process, yogurt already contains lactase enzymes and proteins that are broken down smaller than fresh milk. So many older people who used to feel bloated when drinking milk find yogurt more tolerable. Some human studies show that using probiotic yogurt daily can increase gut microbiome diversity in just about 4 weeks, a short enough time frame for you to observe changes in your own health journal. Digestive benefits lead to nutritional benefits. Older adults are very prone to protein deficiency due to low intake and poor absorption, leading to muscle loss and difficulty standing up or sitting down. Yogurt provides easily digestible protein, accompanied by probiotics that make nutrient absorption smoother. If combined properly, you can increase your total daily protein intake while keeping the stomach comfortable. From the clinic, we have recorded many real cases. A 70-year-old woman with many years of constipation and frequent bloating after dinner was guided to eat a breakfast of 1 cup of unsweetened yogurt mixed with 2-3 tablespoons of rolled oats, a little ground flaxseed, and 20-30 g of blueberries. After just 4 weeks, she had more regular bowel movements, a lighter stomach, and regained her appetite. Another patient after gastrointestinal cancer treatment often felt nauseous and afraid to eat. When switched to a soft meal of probiotic yogurt, half a ripe banana, and 1 tablespoon of thin peanut butter, the patient reported reduced nausea and was able to maintain midday energy. Of course, each body is different, but the common denominator is: when the gut is calm, eating is enjoyable, and when eating is enjoyable, the body has the materials to recover. Application is very simple. Seniors can start with 1 cup of unsweetened yogurt, 100-150 g in the morning or 1-2 hours after a main meal. If the stomach feels fine, gradually increase to 2 cups divided into 2 times during the day. A tip to optimize: add probiotics, that is, fiber that feeds beneficial bacteria such as oats, ground flaxseed, chia seeds, or a small handful of berries. Suggested formula for a quick breakfast: 1 cup of yogurt plus 2 tablespoons of rolled oats plus 1 tablespoon of ground flaxseed plus 20-30 g of blueberries. Mix well, let sit for 5 minutes to soften, then eat. For those with weak teeth, it can be lightly blended smooth or choose unsweetened drinking yogurt. Diabetics can still use it if counted into total carbs. Prioritizing unsweetened and pairing with fiber/protein so blood sugar rises steadily. If prone to acid reflux, use yogurt during the day instead of close to bedtime and sit upright for 15-20 minutes after eating. Safety note: people with severe lactose intolerance can try lactose-free yogurt. Anyone taking antibiotics should separate yogurt from the medication by 2-3 hours so probiotics can work effectively. When buying, read the label for live and active cultures. Prioritize unsweetened or low sugar and limit overly sweet flavors. Store in the refrigerator and use within 3-5 days after opening. The key is to maintain regularly for at least 4 weeks and record simple things: number of bowel movements per week, level of bloating after meals, appetite, body weight, and morning energy level. Once the gut runs smoothly, the next benefits will clearly appear in other systems. When talking about immunity in people over 60, the most reasonable starting point is still the gut, because most of the immune system is stationed right at the intestinal mucosa. When the microbiome is imbalanced due to eating little fiber, taking many medications, or prolonged stress, the ability to recognize pathogens declines. The body becomes prone to persistent inflammation and repeated infections. Yogurt is a fermented food containing beneficial bacterial strains such as Lactobacillus and Bifidobacterium. When used regularly, they can help increase the number of beneficial bacteria and work directly with immune cells. Specifically, beneficial bacteria help activate lymphocytes and neutrophils in the right direction, while also promoting the body to secrete IgA antibodies right at the mucosa, the upper respiratory tract, the digestive tract, thus blocking pathogens right at the gateway. At the same time, a stable gut environment helps the immune system better distinguish between friend and foe, reducing overreactions and lowering circulating inflammatory mediators, cytokines in the blood, which are the cause of fatigue, aches, poor sleep, and delayed recovery. Looking at daily life, older adults are often the group most prone to seasonal colds, bronchitis, and even pneumonia when the weather changes. Older women also often face recurrent urinary tract infections. Regular supplementation of probiotic yogurt is a simple way to take the hit early. Some human studies have recorded that groups eating yogurt containing beneficial bacterial strains for 8-12 weeks had fewer colds and flu than groups that did not. From clinical practice, we encounter many similar stories. Mr. H, 68 years old, used to have 4 or 5 bouts of bronchitis each year with prolonged coughing. After adding unsweetened probiotic yogurt to his breakfast and maintaining it for 3 consecutive months, the number of infections was reduced by nearly half, and each episode was milder and recovered faster. A 60-year-old female nurse working in a nursing home, where the risk of infection is very high, maintained 1 cup of yogurt every morning with a little oatmeal and berries. She shared that for nearly 2 cold seasons, she no longer had to take leave because of the flu as before. Applying this to the diet is very easy. Start with 1 cup of unsweetened yogurt, 100-150 g, in the morning or 1-2 hours after lunch, when the stomach is warm and the body receives beneficial bacteria better. If the stomach is comfortable, you can divide into 2 cups at 2 different times of the day. To help beneficial bacteria settle better, give them food, which is soluble fiber, probiotic. 1-2 tablespoons of rolled oats, ground flaxseed, chia seeds, or a small handful of blueberries/strawberries. Diabetics can still use it if the portion is counted into total carbs, prioritizing unsweetened yogurt and eating with fiber, protein so blood sugar rises slowly. Those who are easily bloated can choose unsweetened drinking yogurt or lactose-free yogurt. If taking antibiotics, separate yogurt from medication by about 2-3 hours so beneficial bacteria have more chance to survive. When buying, read labels for live and active cultures. Prioritize low sugar, few additives, refrigerate and use within a few days after opening. A small tip to maintain: prepare 5 cups for 5 working days along with small packs of oats and bags of frozen berries. That way you only need 2-3 minutes to have an immune-friendly snack. Combine with other basic habits: drinking enough water, washing hands properly, getting enough sleep, vaccinations as recommended. The effect will be much clearer than doing just one thing alone. And remember that strong immunity does not come overnight. Give the body at least 4 weeks of consistency. Record the number of sneezes, runny nose, prolonged coughs, and see what adjustments you need for the next week. Those with underlying diseases or taking immunosuppressive drugs should consult their doctor before making major dietary changes. When the immune shield is strong, the next step is to strengthen the foundation that helps us stand firmly and move safely every day. When the immune system is stable, the next step is to take care of the foundation that helps us stand firm every day: bones and joints. After the age of 60, bones gradually lose density, cartilage thins, and the muscles around the joints weaken, making every time you stand up, climb steps, or turn your body feel like a struggle. Yogurt is a simple but effective piece of the puzzle because, in a small serving, it already contains calcium, vitamin D, protein, and phosphorus, the 4 directly supporting bone. Along with that, the potassium in yogurt helps the body balance acid, limiting the situation of withdrawing calcium from bones when the diet lacks fruits and vegetables. In simple terms, calcium is the core material of bone. Vitamin D is like the doorkeeper that helps calcium go from the intestine into the blood and then into the bone. Protein is the material for muscles and the tissue around joints, including collagen, to be rebuilt. And phosphorus combines with calcium to form a strong structure. When these 4 factors are present regularly, bones become denser, joints function more smoothly, and the muscles around the joints have enough strength to support bones, thereby reducing the risk of falls, fractures over time. Some population analyses show that those who eat yogurt daily have a significantly lower risk of osteoporosis compared to those who do not. This matches what we see in practice. Small, consistent habits create clear differences. Applying this to life is straightforward. The goal is to prevent hip fractures, femoral neck fractures, complications commonly seen in postmenopausal women that leave severe consequences. A 75-year-old female patient who once suffered a femoral neck fracture was advised, in addition to standard treatment, to supplement with vitamin D-rich yogurt daily, while also practicing standing up, sitting down on a chair 10 times twice a day. 6 months later, her walking ability recovered faster than the group that did not maintain yogurt regularly. She also regained confidence in going to the market and cooking. Another case, an 80-year-old man with knee osteoarthritis was afraid of moving because of pain. He switched his afternoon snack to 1 cup of unsweetened yogurt mixed with a little granola and 5-6 cashews, then practiced 10-12 minutes of light knee exercises, knee presses, leg extensions, side steps. After about 8 weeks, the level of pain decreased, the range of knee flexion extension improved, and at night he had less sharp pain when turning. There is no miracle, only that bones and muscles were provided with the right materials at the right time, joints were gently lubricated, and the muscles around the joints gradually had enough strength to support. Specific application: older adults can maintain 1-2 servings of yogurt per day, each serving 100-150 g. In the morning, use unsweetened yogurt mixed with 2 tablespoons of rolled oats plus 1 tablespoon of ground flaxseed plus 20-30 g of berries to both add fiber and support calcium absorption better thanks to natural vitamin C from fruit. In the afternoon, if you need a filling but light snack, mix yogurt with a small handful of low-sugar granola and a few unsalted cashews. Protein increases to give the muscles around the joints the material to recover. Those with weak teeth can use unsweetened drinking yogurt. Those prone to acid reflux should use it during the day instead of close to bedtime. A small note to make calcium go into bone effectively: spend 10-15 minutes in the morning sun before 9 a.m. a few days a week so the body can produce vitamin D. If the doctor has prescribed vitamin D, take it at the correct dose and have regular checkups. At the same time, limit soft drinks and excessive salt because they cause calcium loss. Diabetics can still use yogurt if they choose unsweetened types, count it into total carbs, and eat with fiber, protein so blood sugar rises smoothly. For those who must limit salt or have edema, prioritize low-sodium yogurt, avoid pre-flavored varieties with a lot of sugar. Anyone taking osteoporosis medications, bisphosphonates, etc., should ask their doctor about the timing of taking the medication compared to yogurt meals so as not to affect absorption. Track progress with everyday signs. The ability to get up from a chair without using hands, climbing 1-2 steps without running out of breath, the level of joint pain upon waking, the number of falls, and confidence when going to the market/walking. Recording weekly will show you how small habits are gradually raising the foundation of bones and joints. And because strong bones need strong muscles to support, after this part, we will add another important link: how to use yogurt as a companion to protein meals, to help muscles absorb better and recover faster after 10-15 minutes of daily movement. When talking about cardiovascular and metabolic health in people over 60, yogurt is beneficial on both fronts. It both supports blood vessels to relax and helps blood sugar and blood lipids fall into place. During fermentation, yogurt forms bioactive peptides and contains added probiotics. These two factors together help blood vessel walls open more gently, thereby blood pressure tends to drop slightly and heart rhythm becomes more stable. At the same time, the natural potassium and magnesium in yogurt contribute to regulating heart muscle contraction, supporting blood pressure control, something very valuable when many older adults face age-related hypertension. Regarding blood lipids, the habit of consuming yogurt regularly is associated with reducing LDL bad cholesterol and increasing HDL good cholesterol. These are the two backbone indicators doctors monitor when assessing heart disease risk. For blood sugar metabolism, yogurt's easily absorbed protein helps with longer satiety, while probiotics and fermentation peptides can improve insulin sensitivity, making post-meal blood sugar rise more gently, especially when yogurt is eaten with fiber. Some meta-analyses of dozens of observational studies show that those who regularly consume fermented yogurt have a lower risk of heart disease. In practice, we also see that groups of type 2 diabetes patients who replace sweet snacks with low-fat, unsweetened yogurt often improve HbA1c after a few weeks to months, along with modest weight loss and better behaved blood pressure. Application in daily life is very straightforward. Older adults often have both hypertension and dyslipidemia, and also tend to get hungry between meals and reach for sweets or dairy candies, foods that make blood sugar spike quickly and then crash while adding unnecessary bad fats. Simply changing snack habits: 1 cup of low-fat, unsweetened Greek yogurt, eaten with 20-30 g of berries, blueberries, strawberries, and 1 tablespoon of ground flaxseed. Berries are rich in anthocyanins that support small blood vessels, while flaxseed adds soluble fiber that helps LDL cool down more easily. If more satiety is needed, add 1-2 tablespoons of low-sugar granola or a few walnuts. In the case of weight management, simply keep to the correct portion size. Timing is flexible. In the morning instead of pastries, or 1-2 hours after lunch to avoid late afternoon hunger. In the evening, eat at least 60-90 minutes before bedtime if prone to acid reflux. Hypertensive individuals should note to choose plain, low-sodium options. Avoid flavored varieties since they often come with a lot of sugar. Diabetics can still use it if counted into total carbs and eaten with fiber, protein so blood sugar rises slowly. A small tip is to eat slowly, chew the fruit and nuts thoroughly so the brain has time to register satiety. Some safety notes and maintenance tips: if lactose intolerant, try lactose-free yogurt or Greek yogurt, which usually has less lactose. Those taking antibiotics should separate yogurt intake from the medication by 2-3 hours. For those being treated for dyslipidemia or hypertension, yogurt is a supporting piece, not a replacement for medication. Continue to take medications as prescribed and attend regular checkups. At the supermarket, read labels to find live and active cultures. Prioritize unsweetened, low-fat options. If you want a light sweetness, add a few slices of ripe banana or a small spoon of honey instead of choosing pre-sweetened types. As for portions, 1-2 cups, 100-150 g each, per day is reasonable for most older adults. Those who need more protein for muscle can choose the Greek version to achieve higher protein in the same volume. Combining with foundational habits such as walking 20-30 minutes, reducing salt at dinner, Keeping a regular sleep schedule and drinking enough water will amplify the cardiovascular metabolic benefits of yogurt compared to using it alone. Track progress with familiar signs: waist circumference, body weight, morning blood pressure, feeling of chest heaviness after meals, the level of sweet cravings between meals, and fasting blood sugar if you are self-monitoring. Recording for 4 consecutive weeks will give you a clear picture to adjust portion size or timing as appropriate. After talking about cardiovascular and metabolic benefits, another easily noticeable advantage of yogurt is its effect on mood and skin, 2 factors that determine daily quality of life for people over 60. Modern science now views the gut as a communication station with the brain. When the gut microbiota is balanced, the body is able to produce more neurotransmitters such as serotonin, resulting in a more stable mood, less anxiety, and easier relaxation. Yogurt is a fermented food rich in probiotics. Regular use helps increase beneficial bacteria and reduce harmful toxin-producing bacteria. When toxins and background inflammation decrease, the body experiences less oxidative stress, sleep becomes easier, and daytime fatigue is reduced. The fermentation process also produces bioactive peptides, together with probiotics. They may support the gut in sending signals that help increase melatonin synthesis at night, thereby making sleep deeper and more continuous, especially important since many older adults often wake up during the night. For the skin, reducing background inflammation is key. Probiotics help tighten the gut lining, limiting inflammatory triggers from entering the blood. The result is less redness, fewer tiny breakouts, and reduced dryness or itchiness in those with eczema-prone skin. Some controlled clinical trials in older adults recorded that the group consuming probiotic yogurt showed reduced anxiety scores and improved sleep quality compared to the non-consuming group. While not a sleeping pill, yogurt creates a stable digestive foundation, enabling the brain to slow down more easily at night. From clinical practice, Mrs. M, 65 years old, complained of years of insomnia, post-dinner bloating, and dry, dull skin. She was advised to switch her evening snack to 1 cup of unsweetened yogurt mixed with 6-8 soaked almonds and 1 tablespoon of ground flaxseed, consumed 60-90 minutes before bed. After about 6-8 weeks, she reported falling asleep faster, waking up with less heaviness in her head and less skin flaking. By the 3rd month, her complexion was brighter and less itchy during dry weather. Another case, Mr. T, 70 years old, suffered from recurrent rosacea, especially during stress. He added probiotic yogurt twice a day after breakfast and in the afternoon instead of sweet snacks, along with reducing alcohol and spicy foods. After 10 weeks, facial redness decreased significantly and flare-ups became less frequent. Application is very practical. During the day, have 1 cup of unsweetened yogurt with a small handful of berries to support antioxidants for the skin. In the evening, if better sleep is desired, choose 1 cup of low-fat Greek yogurt, high in protein, low in sugar, mixed with 6-8 almonds or 2-3 walnut halves. Good fats and the natural tryptophan in yogurt, when combined with a balanced dinner, provide the body with raw material to produce serotonin, which then converts into melatonin at night. Those prone to acid reflux should eat at least 60-90 minutes before lying down and remain upright for 15-20 minutes after eating. For diabetics, yogurt is still suitable if unsweetened, counted into total carbs, and eaten with fiber flaxseed oats to make blood sugar rise gently. If lactose intolerant, try lactose-free or Greek yogurt. These options are usually gentler on the stomach. Beyond eating, yogurt can also be used as a mild face mask 1-2 times per week. Choose unsweetened yogurt, apply a thin layer to clean skin for 5-10 minutes, then rinse with warm water. There is no need to mix honey or lemon if the skin is sensitive. A yogurt mask does not replace moisturizer but may temporarily soothe the skin. Always test on a small area first, especially if you have dermatological conditions, and consult a dermatologist if the skin is irritated or under special topical treatment. Drinking enough water, keeping a regular sleep schedule, light morning sun exposure for a few minutes, and walking 20-30 minutes daily will synergize with yogurt for more sustainable improvement in mood and skin. Track progress with familiar indicators: sleep quality, time to fall asleep, number of awakenings, daytime anxiety levels, number of days with skin redness/itching, and morning skin dryness. Recording for 4 consecutive weeks will show how this small habit is working. Safety note: Those with severe immunosuppression or under special treatment should consult a doctor before increasing fermented food intake. Those taking antibiotics should separate yogurt intake by 2-3 hours. When purchasing, read labels for live and active cultures. You prioritize unsweetened and low additive options. At this point, you may have clearly seen, yogurt is not a miracle drug, but a multitasking food, cheap, easy to find, and able to address 5 major concerns of old age: unsettled digestion, weak immunity, fragile bones and joints, unstable cardiovascular health, and declining skin and mental vitality. The key does not lie in adding more pills, but in one small habit repeated every day. 1-2 cups of unsweetened yogurt at the right time, accompanied by fiber and a bit of light exercise. When the gut is calm, the body absorbs better. When bones and muscles have regular building materials, we rise more steadily. When heart and blood sugar are stable, sleep and mood also become smoother. Take 4 weeks to try. Each day choose a fixed time, morning or after lunch. Eat 1 cup of unsweetened yogurt. If it suits you, increase to 2 cups divided into 2 times. Record 5 simple things: number of days with constipation/bloating, quality of sleep, morning energy level, joint pain when standing up, and skin condition. After 28 days, open your notebook. What has improved? What needs adjustment in portion or timing? Share your experience in the comments. Each real story will give strength to many people of the same age who are struggling just like you today. Thank you for staying with me until the very end. Your perseverance is the most important part for the body to change.